Regular exercise is very important for patients with Parkinson's disease. Although exercising will not stop the progression of Parkinson's disease, it will help you manage its symptoms more effectively and provide many benefits. The benefits of exercise include improving muscle and joint stiffness, keeping muscles strong, promoting good posture, helping to improve your balance, improving flexibility and mobility, improving your cardiac and respiratory function, providing increased energy level, helping constipation, decreasing rate of bone loss, and helping symptoms of depression. If you don't exercise already, it is best to start as soon as possible. You should discuss this with your physician, who may refer you to a physiotherapist. Physiotherapist is an expert in physical therapy and exercises. He or she may recommend certain exercises to help your condition and may tell you exercises you should avoid. Physiotherapists can also advise on how hard you should exercise and how long you should exercise for. Some of the basic principles of exercise include aerobic exercises, which involve the cardiac and respiratory systems. These usually need to be continuous and should last around 10 to 20 minutes in order to be effective. Passive exercises are for those individuals who have a hard time to move by themselves. Someone has to help them to move their limbs for them. Resistance exercises include imposing external resistance against muscles, such as lifting weights. Exercise can be as simple as gardening, walking, and swimming. On top of these activities, you should consider joining an exercise program in which you should exercise at least 3 days a week for about 30 minutes at a time. It is best to exercise when you are not fatigued and your medications have your symptoms under control. This is usually at the same time every day. When you first start exercising, you should start slowly. Exercise only for 10 to 15 minutes at a time. You may increase the duration to 30 minutes once you have built up your stamina. It is important to have a warm-up period before you start to exercise and also to have a cool-down period after you are done. In these periods, you need to stretch to warm up your muscles. Also, you should regularly drink water while exercising to keep you well hydrated. Many people enjoy their exercise more when they are not alone, and they are more likely to continue exercising on a regular basis. Lastly, you should stop exercising if you feel fatigued, hurt, or sick. The kind of exercises you will do will depend upon your physical ability. In general, as you get older, you lose strength in your muscles. Therefore, if you are an older individual, resistance exercises such as lifting weight may be more helpful in slowing down the loss of muscle strength and improving your balance and mobility. For your abdominal muscles, sit-ups will be beneficial if you are able to do them. If you have knee or hip arthritis, regular exercise will help you deal with it as well. If you have diminished shoulder motion, also known as frozen shoulder, arm and shoulder exercises may be effective. Posture problems such as scoliosis are helped with exercises that focus on strength and back flexibility. Pelvic and lower abdominal exercises are beneficial for constipation and urinary dysfunction commonly associated with Parkinson's disease. If you have advanced Parkinson's disease or other health-related issues such as heart disease or diabetes, these will have an effect on what kind of exercises you can do. Therefore, you should consult with your physiotherapist to find exercises most suitable for your needs and abilities. This information is provided for educational purposes only and should not be taken as a substitute of the medical advice and care provided by your physician.